Hi everyone, Kafri here from Spine Health and Wellness Center. It is an established scientific fact that if you don't eat properly or if you don't eat the right kinds of food, you could actually be diseased. And the same way, if you don't drink adequate amount of water, you could actually fall sick. But in a scale of existence, we talk about three very vital things that we need to survive. We talk about air, we talk about water, and we talk about food. And we know that in order of preference, air is actually ranked highest among the three. The fact is that you cannot go certain minutes without air, but you could go a day maybe without water, but you could go for days without food. But we're realizing that you actually, if you don't eat properly, you could have problems. And if you don't drink adequate amount of water, you could have problems. But most people don't realize that if you don't breathe properly, you could also have a lot of problems as well. What am I talking about? Most people are not connecting the dot that sometimes the migraines, the tension headaches, the numbness and tingling sensations they've been experiencing in their fingers, the chest tightness, the shoulder pains, and the neck stiffness could all be coming about as a result of not breathing properly. Why am I saying so? The reason is that physiologically there is supposed to be a particular pattern by which we are supposed to be breathing. What do I mean by that? Whenever you are breathing, your belly is supposed to move out and down by the actions of the diaphragm. However, for most people, when they are breathing in, they notice that their chest actually goes up. Now, what happens along the line is that it is not only your chest that moves up when you are doing such kind of breathing, you also eventually recruit the muscles in your neck to do such kind of work. So, over time, such repetitive motion will now begin to cause the muscles in the chest to tighten, and it will also cause the muscles in the neck, like the sternocleidomastoid and the scaling muscles, to become very tight or sore and a whole lot of other things. And that could actually bring about some of the symptoms that I mentioned earlier on in this video. Now, if you look at babies and how they breathe, babies have got a very natural pattern of breathing. They take in the air, their belly comes out, and when they are breathing out, the belly sinks in. There is a reason why it is so. But most times, we end up seeing a lot of adults having even a reversed pattern of breathing. This is not good. So if you've noticed over time that you've gone to the hospital, you've been given the medication, you are doing a lot of therapy, but you're not getting a lot of relief from the neck pain you've been experiencing for this long, then it's high time you begin to consider your breathing pattern. There's a likelihood that you are not breathing properly, and that could be the missing link. Learn to breathe properly. Thank you.